What if I told you that the solution to your chronic foot pain might be flowing through your veins right now? What if we could take a small amount of your own blood, concentrate its most powerful healing components, and inject them directly into your damaged tissue to restart the healing process? Sounds like science fiction, but it's happening in my office every day. No foreign chemicals, no synthetic drugs, just your own biology, concentrated and delivered exactly where your body needs it most. My name is Dr. Andrew Schneider, and I'm a podiatrist here in Houston, Texas, where I've been helping patients overcome chronic foot and ankle pain for over 25 years. Before we talk more about this treatment, please take a moment to like this video, hit the subscribe button, and share it with anyone who's been told surgery is their only option. I want to offer you my complete audio course on regenerative medicine absolutely free at www.regmedcourse.com. This comprehensive course reveals everything you need to know about these breakthrough treatments. You might not realize it, but your blood contains incredibly powerful healing factors that are just waiting to be activated. Every time you get a cut, these factors immediately go to work. Blood clots to stop the bleeding. Growth factors signal your body to send repair cells to the area, and new tissue begins to form. The problem is that when you have chronic foot or ankle pain, these natural healing factors often aren't reaching the damaged tissue in high enough concentrations to complete the repair process. That's where regenerative injections come in. Today I want to tell you about two powerful treatments that can concentrate and deliver your body's own healing factors to your damaged tissues: PRP and DPMX. These aren't experimental treatments, they're proven therapies that I use every day to help patients avoid surgery and get back to the activities they love. Let me start with PRP, or platelet-rich plasma. This treatment harnesses the healing power that's already in your blood and concentrates it to a level that can actually repair damaged tissue. Your body contains several components: red blood cells that carry oxygen, white blood cells that fight infection, plasma, which is a liquid part of your blood, and platelets. Most people think platelets are just for clotting blood when you get injured, but they're actually much more powerful than that. Platelets contain hundreds of different growth factors, specialized proteins that signal your body to send healing cells to an injured area, stimulate the formation of new blood vessels, and promote the growth of new healthy tissue. Here's the problem. In normal blood, platelets make up only about 5% of the total volume. That's not enough to create significant healing in chronically damaged tissue. But what if we can concentrate those platelets to 10, 15, even 20 times their normal level? That's exactly what PRP does. The process is remarkably straightforward. We draw a small amount of your blood, and it's placed in a specialized centrifuge that spins at high speeds to separate the different components based on their density. After 10 minutes of spinning, your blood separates into distinct levels. The red blood cells settle at the bottom, the platelet-poor plasma rises to the top, and in the middle is a golden layer of platelet-rich plasma, liquid gold for healing. We carefully extract this platelet-rich layer, and what we have is a concentrated healing solution that contains 5 to 10 times the normal concentration of growth factors and healing proteins. I then inject this concentrated healing solution directly into your damaged tissue. We're delivering a powerful dose of your body's own healing factors exactly where they're needed most. PRP is particularly effective for chronic tendon injuries that haven't responded to conventional treatments. If you've been dealing with Achilles tendonitis, plantar fasciitis, or other tendon problems for months without improvement, PRP can often restart the healing process that's stalled. The reason PRP works so well for tendon injuries is that tendons have relatively poor blood supply. This means fewer nutrients and healing factors naturally reach these areas. By injecting concentrated growth factors directly into the damaged tendon, we can overcome this limitation and stimulate healing even in poorly vascularized tissue. PRP is also excellent for early arthritis in foot and ankle joints. While we can't reverse severe arthritis, PRP can often reduce inflammation, improve joint function, and slow the progression of cartilage damage. Many patients find they can delay or avoid joint replacement surgery after successful PRP treatment. Fasciitis and other degenerative soft tissue conditions also respond well to PRP, whether it's plantar fasciitis that's become chronic or other inflammatory conditions affecting the soft tissue of your foot and ankle. PRP can help break the cycle of chronic inflammation and promote true healing. Let me walk you through what you can expect during a PRP treatment, because many patients are surprised about how comfortable and straightforward the process is. The entire procedure is done right here in the office and takes about 30 minutes from start to finish. After we draw your blood and I'll process it in the centrifuge, I'll prepare the injection site. Depending on the area being treated, I may use ultrasound guidance to ensure that PRP is placed exactly where it needs to be. The injection itself may feel similar to other injections you may have received. Some patients experience mild discomfort during the injection, but it typically resolves quickly. In some cases, I may anesthetize the area before I inject the PRP if I'm concerned about pain. After the injection, you may notice some soreness in the area for a day or two. This is completely normal and actually a good sign. It means the PRP is stimulating an inflammatory response, which is the first step in the healing process. Unlike cortisone injections, which often provide rapid but temporary relief, PRP works by stimulating your body's natural healing processes, and that takes time. Most patients begin to notice improvement within 2 to 4 weeks of treatment, with continued improvement over the following months. The really exciting part is that the results tend to be lasting. Because we're actually healing the damaged tissue rather than just reducing inflammation temporarily, many patients experience relief that lasts for years. Now, while PRP is incredibly effective for many patients, there are situations where we need something that might be more powerful than someone's own blood. That's where DPMX comes in. DPMX is derived from Wharton's jelly, a substance found in the umbilical cord tissue that's ethically donated after healthy births. This might sound unusual, but umbilical cord tissue is incredibly rich in growth factors, proteins, and anti-inflammatory compounds that can promote healing. What makes DPMX different from PRP is that it contains not just growth factors, but also structural proteins, anti-inflammatory cytokines, and other healing components that aren't found in concentrated platelets. It's like having a complete toolkit for tissue repair rather than just one set of tools. DPMX is particularly valuable for patients who haven't responded well to PRP or for those with more advanced tissue degeneration. Sometimes damaged tissue just needs more than growth factors. It needs the structural scaffolding and the anti-inflammatory support that DPMX provides. I also find DPMX particularly helpful for diabetic patients and older adults whose natural healing processes might be slower or less robust. The comprehensive healing factors in DPMX can often succeed where other treatments have failed. Let me help you understand which treatment might be best for your situation. PRP is typically my first choice for patients with chronic tendon injuries, early arthritis, or inflammatory conditions who are otherwise healthy and have good healing capacity. If you're dealing with plantar fasciitis, Achilles tendonitis, or similar conditions and haven't found lasting relief with conventional treatments, PRP could be an excellent option. DPMX becomes my preferred option in several situations. If you've tried PRP before without adequate results, DPMX might provide the additional healing factors you need. If you've had more advanced tissue degeneration, meaning the damage is more extensive or has been present for a very long time, DPMX's comprehensive healing profile can be effective. DPMX is also ideal for patients who can't use PRP. If you're taking blood thinning medication like warfarin or Eliquis, we can't safely draw and process your blood for PRP. But DPMX doesn't require your blood, so it's a perfect alternative. Diabetic patients often respond better to DPMX because diabetes can impair the function of your own platelets and growth factors. The robust healing factors in DPMX can overcome these limitations. The application process for DPMX is very similar to PRP. It's injected using the same techniques, often with ultrasound guidance for precise placement. The procedure takes about 15 to 20 minutes and there's no downtime afterwards. Like PRP, DPMX works by stimulating your body's natural healing processes, so the results develop gradually over weeks and months. Many patients notice some improvement within the first few weeks, with controlled improvement over the following months. What's remarkable about both of these treatments is how they work with your body rather than against it. We're not suppressing your immune system like cortisone does, or masking symptoms like pain medication does. we're actually giving your body the tools it needs to heal itself. Here's what I find most exciting about these treatments. They can often help patients avoid surgery altogether. Let me be transparent about the cost of these treatments. Currently, neither PRP nor DPMX is covered by most insurance plans. This is frustrating, I know, especially when you're dealing with the chronic pain that's affecting your quality of life. However, I want you to think about this as an investment in your long-term health and quality of life. For simplicity, we price PRP and DPMX the same, so you can choose the treatment that's the most appropriate for your condition without cost being a factor. Consider what you've already spent on treatments that provided only temporary relief. Physical therapy copays, doctor visits, prescription medication, cortisone injections, these costs add up quickly. More importantly, what's the cost of continuing to live with chronic pain? So when you factor in the potential to avoid surgery with all its associated costs, risks, and recovery time, regenerative injections often represent significant savings both financially and in terms of your quality of life. Let me explain why these treatments are so effective, because understanding the science can help you make an informed decision. When tissue is injured, your body initiates a complex cascade of healing events. Growth factors signal cells to migrate to the injury site. New blood vessels form to supply nutrients to the healing tissue. Stem cells are activated to help with repair. Anti-inflammatory compounds help to resolve initial inflammatory response so healing can proceed. In chronic cases, this healing cascade often becomes inadequate or stalled. The tissue remains in a state of chronic inflammation without progressing to true repair. Both PRP and DPMX work by providing the biological signals and building blocks needed to restart and complete the healing process. They're delivering concentrated doses of the same factors your body would naturally produce, but in quantities sufficient to overcome the barriers that have prevented healing. What's particularly exciting is that these treatments don't just mask symptoms, they actually change the biology of the damaged tissues. Instead of weak scar tissue, your body produces new, healthy tissue that can function normally. The results I see with these treatments continue to amaze me, even after years of using them in my practice. Patients consistently report not just pain reduction, but actual restoration of function. They can return to activities they've given up. They sleep better because they're not waking up with pain, and they have confidence in their bodies again. One patient told me, "I forgot what it felt like to walk without thinking about my feet." Another said, "It's like getting my life back." Clinical studies support what I see in practice. Research shows that PRP provides significant improvement in 70 to 80% of patients with chronic tendon problems, with results that are maintained long term. Studies on umbilical cord-derived treatments show similar success rates. What I love most about these results is they represent true healing, not just temporary relief. As we wrap up the exploration of these powerful regenerative injections, I want you to think about the remarkable fact that your own blood contains the healing factors needed to repair damaged tissue. We just need to concentrate them and deliver them where they're needed most. Whether it's PRP harnessing your body's own healing power or DPMX providing comprehensive tissue repair factors, these treatments represent a powerful alternative to surgery that works within your body's natural healing mechanisms. When nature and science works together like this, the results can be truly remarkable. You don't have to choose between living with chronic pain and undergoing surgery. There's a third option that might be exactly what you've been looking for. Please take a moment to like this video, hit the subscribe button so you don't miss the final video in this series. Share the video with anyone you know who's been told surgery is the only option. And don't forget to get your free comprehensive audio course on regenerative medicine at www.regmedcourse.com. This course provides even more detailed information about these treatments and can help you make the best decision about your foot health. Thanks so much for watching, and have a great day.